Came to hear Michael talk, obviously about neighbourhoods and what he's done.
I feel this work is really important to help disadvantaged and vulnerable children in our region.
I am the early childhood leader for DCD for the partnerships at the Mid-Murray Council.
I've come today because I am the coordinator of the Standby Response Service, which is a suicide bereavement service, and it covers this area, but people don't know that. So I'm networking and seeing what's available in this area for the people of the area.
I'm from the Department of Education Child Development. I'm the Team Leader Support Services. I'm representing the Mid-Murray Council, and I'm also a local mum for the youth of this area, so I'm keen to help stop this disturbing trend.
We're moving to the area. We're building and the kids will be going to school here next year.
I have come because I want to see things happen for families in the community.
I'm representing community centres this day, so I work for them, and this is part of the work that we're doing.
I'm the Mayor of the Council, so I just want to learn a bit about the program and how we can make things better for our community.
I'd like to see a lot more involvement by parents, caregivers, whether they be grandparents, whether they be sporting organisations.
What initiatives they've implemented in the United States that can be applicable here.
Or anything that proves life and education for our young children, safety.
More awareness of the needs of families and children, and that we all work together.
More focus on educating the kids.
More community involvement, more opportunities.
Programs for the kids to do, especially in rural areas. Young children doing really well, those who aren't particularly, and families who aren't doing very well, to be supported and encouraged and strengthened.
I'd like to see the best opportunities for children in our community so they can achieve their potential and be real contributors to our community.
We're here to look at some very harsh facts about children's developmental vulnerability. We're looking at learning from what's worked elsewhere and where we can go from here in terms of making a difference locally. Mid-Murray Family Connections is a network of organisations. Many of you are members of it, but some of you are not. It was formed in July 2013 after these results were brought to the area's attention. And basically at that point, it's been quarterly meetings of the network to build connections between organisations and to develop activities that were going to hopefully address some of these issues.
So I looked at your numbers. You've got 280 something folks that are in your total population, and we're struggling with 14 million children in America that are in poverty. And usually when we track the poverty and the educational trends, they're tracking pretty closely together. And so our job has been to try to figure out how do we impact that number in a way that we can reverse the cycle of generational poverty. That's what we want to do. And so the first thing we had to do was to make a case to the administration that in fact we can do something. So the good news is, no matter where you go in the world, we do know what works. So there's a lot of research out there now about what works. The question is, can we put it in the right package so that we get substantive impact? That's the challenge. Here's how we got to where we are with Promise Neighborhoods. Promise Neighborhoods has really been 40 plus years in the making. Starting in a little bitty church in Harlem, New York, where Jeff Canada and my boss, Angela Glover Blackwell, decided they would start trying to work on children's issues. And Jeff, taking his program from this small little program to beginning to work with 90 blocks and 11,000 children every year. Senator Obama at that time went to visit his site, saw that work, and said, if I become president, I want to do that. So Jeff and Angela got on the phone with each other, and this is where the relationships are so important, because this was not planned. This was two people with a relationship able to take advantage of a political opportunity. Jeff got on the phone with Angela and said, you know, I don't think he's going to become president. But if he does, it would be really foolish for someone else to design our program. The good news is he became president. And by the time he became president and the White House transition team got formed, we were able to hand the White House it was a huge binder. That was the Promise Neighborhoods program. It had in it the best science around what would be the best developmental results and indicators, measures, if you were going to support children from cradle to career. We've got to bring discipline to this team. When I talk about the team, I'm talking about the 61 communities that are in our community of practice. Much like all of you in here, I would consider this our community of practice. So we introduced a concept called results-based accountability as our discipline, meaning this is going to be the discipline by which we move from talk to action. It's no longer good enough to look at a map like that, all that good data, and then just start guessing about what we should do. Because that's what we usually do. We just start guessing, right? So you take good data and you start corrupting it by just guessing. There is a place for hunches, don't get me wrong, but there is greater discipline that we can bring to our inquiry, and there's greater discipline we can bring to our practice. So we introduced RBA, 10 results, 15 indicators. We then decided that we would try to also overlay this frame of collective impact. For me, collective impact is only important if you're holding population level accountability. Which means for us, we've already done the small stuff. Now it's time to go after the big stuff because we're losing the battle because that trend line is like a wave, going to wash over us, right? So it means the problem is too big for one organization to solve it now. Now we have 61 communities focused on disciplined execution who can tell you their baselines, their targets, their solutions, how those solutions are based in evidence and their best experience, their partners, and their partner contributions linked to performance measures. There are only a few things that are going to get that trend line going in the right direction. And my question is to root those out. Does that make sense? There's only a few things, and those few things are going to be painful for us to do. So if I'm not feeling pain, if I'm not feeling discomfort, I really do know that I'm not doing the right work. If you really want to know if you're doing the right work, it's like when you're exercising. You know when you're really pushing it, right? You will know in this work if you are really pushing it or not. You'll know. Your spirit will tell you. And what I can tell you is now, $60 million program. We started with $10 million. Even in all this political fighting, we've taken it to $60 million. Secretary Arnie Duncan mentioned Promised Neighborhoods in the President's budget a couple of days ago. We are the most results-based competitive program in the nation right now. We've only been around 4 years. The programs that precede us have been around for 50 plus. Most people think that this stuff takes a lot of time. Everything I've described to you is not in the regulation, it's not in the law, it's not written down anywhere that it has to be done this way. It's done this way because of our vision at the Institute and the leadership of the partners on the ground choosing to work differently.
So this is your chance to ask questions of Dr. McAfee, Kate Simpson, CEO of Together SA, and also Di Hancock, who is the principal of Truro Primary School, but also a leader amongst the education network in the region.
Running a school is a difficult job. Teaching a class is a difficult job and a busy job. Being a student is busy. So it's really stepping outside of the realm of your space and saying, this matters so much that we're going to do something and get together with other people that feel the same way. In our goals, we've actually created community connections and educator quality are our two key goals. And that community connections is actually very different to the way DECD system works. So it means that we're going to have to rub shoulders with, be involved in other things that are not DECD to make a difference. So it's not funded. It's not. We're not given extra time for it. We have to work those things out for ourselves. So I think that our hope is that when our action plans are actually tweaked, that it kind of connects. Really, it connects with our strategic plan in DECD in Notion, I guess. So we have to be careful to connect it to the things that are going on so that in our accountability, we can say, actually this work is part of our work. Our work is on the ground making a difference for children. And not losing sight of that in all of the stuff that happens.
Those of you that are already part of the network have already begun planning, and we know that our plans have kind of taken us to a point and we're going to review them later today. And we know that there's actually more data we need and more work we need to do around solution making. But when you look at these are on your tables too, but those data maps, that's where we start having a much more interesting conversation locally about what's really changing, and that's where community members get empowered in this place, because they're actually able to hold all of us to account, which, you know, is a bit scary. It's the discomfort that Dr. McAfee's talking about, but it's also where the excitement is that as a whole community we're actually in a position to say, are the trends changing for our children, and are all the resources that come into this community being used in the best possible way for that purpose? And I know one of the things that struck me since beginning to work in this space is in some cases you don't have enough resources. And so one of the pieces of work, once we get the rigour around it, is that people like me, that's back in Adelaide meeting with government departments from all over the place, can actually start raising these issues. And because you're doing it with rigour, I'm in a better position with other leaders from this community to actually exert that influence. So that's the journey we're stepping into. I remember Sue Phillips saying in our first meeting, we want to be trailblazers. And in fact you are. That's what's kind of exciting about this.